my name is Hallie Wohler, and this is Claire Giefer, and we're with the Occupational Therapy Department, and we're here to talk about recovering after back surgery.
All right, through our video today, we have 3 different learning objectives. So by the end of this video, you will be able to recall 3 back precautions to preserve the surgical site and promote healing, demonstrate 3 strategies for adhering to back precautions while completing ADLs, which are activities of daily life. And then the 3rd learning objective is to compare 4 different adaptive equipment and durable medical equipment options to support functional participation and independence while you're recovering from back surgery.
Hello, the first thing we're going to talk about is back precautions after back surgery. We like to call it no BLTs. It's going to be no bending, lifting, and twisting of the back. And if we think about everyday life, we do so much lifting, twisting, and even depending on where you had your surgery along the spine, it's important to keep in mind the twisting of the neck as well. And also bending.
We will now discuss different ways that you can modify your everyday activities while keeping back precautions in mind. The first one would be to use a squat position when reaching for things down below you, like this. Like that. You just want to make sure you're keeping your back straight and your spine in a neutral position, not bending like this. Instead, you want to bend at your knees like this, like I just did. The other option would be a hinging at your waist. So to do that, you have one foot in front of you, you're holding on to a sturdy surface, and then this leg will kind of lift up behind you. You just want to make sure again to keep your back straight, like this. All right. Now, if either of those options don't really work for you, we can introduce adaptive equipment. This here is a reacher. You just click it like this to pick up items. So in this scenario, to grab the oven mitt, I can stand like this and use the reacher while keeping my back precautions in place.
The next thing we'll discuss is sitting. When people normally go to sit, we don't really think about the way our back looks. But since we have back precautions, we want to keep in mind that we're bending at the knee again and keeping the spine in a neutral position. So we're going to reach back for the armrests, and then we're going to bend at the knees and slowly go down, keeping that back nice and straight. Another thing to keep in mind is having everything in front of you and within arm's reach. As you can see, my laptop is in front of me and my phone is in front of me. However, my water bottle is to the side, which would cause me to twist my back. So we always want to make sure to place it in front of you. Another helpful tip is to only be sitting for about 20 to 30 minutes at a time. So at that time you can get up, maybe take a short walk, or maybe just walk to the kitchen to get something.
Next, we're going to talk about getting in and out of bed while keeping your back precautions. So first, to start, to get into bed, again, when we're going to sit, we want to do that squatting by keeping your back straight and bending at the knees. So I'm going to go ahead and start by bending down, and I'm going to reach back for the bed and sit. So to get into a laying position, I want to reach out with my hand and kind of just start bending to my side. What you want to keep in mind throughout this whole process is that you want to keep your hips and your shoulders in line. So if my hips are moving or my shoulders, they're going together. So like this. Bend down. And then once you're in this position, you want your legs to be up. And then you just roll onto your back. And you want to do it all at once. So now to get out of bed, you want to bend the knee and then dig in with your elbow, keeping it really close to you and pushing in while you roll to your side and up to a sitting position.
The next everyday activity we're going to be discussing is using the bathroom. So you have a few different options here. One thing you can get to put over your toilet is a toilet riser, and that'll make it a little bit easier when you go to sit down. or just something with arms that you can put over the toilet, like this one here. So same thing as just sitting in a normal chair. You want to keep in mind the armrest, and just going down nice and slowly. Then once you are here, wiping from the front shouldn't be too big of a problem, but we have a device that could help with that as well. But the big thing here that might be difficult is wiping from behind. If you think about it, how much twisting goes into that, and you have to maintain your back precautions. So one thing I tell people is either scooting up forward to expose more behind and seeing if you can get down there without anything, without any help, just like this. Another option is to do a mini squat. So this would require you to stand up, but yeah, just bending a little bit at those knees will help open up to give more room to reach from behind. So just like this, bending at the knees. The third option is introducing what is called a toilet aid, which what you do is you're gonna put toilet paper around it, make sure it's spiraled, and you can do this either sitting or standing. I'll show the standing since I'm standing right now. And then, yep, without bending, you just can go ahead and reach from behind. Gives you basically a longer arm. And then I will practice it with, you wanna make sure you're a little bit forward, and then practice sitting. You're just gonna reach from behind without having to bend, just reaching from the arm.
Next, we'll be talking about showering. So you may already notice that I am sitting in a shower chair. A shower chair is a really great option for your maintaining balance, preventing falls, and also just keeping your back precautions while you're showering. Really good option. So while I'm sitting in the shower, I have my back straight. One thing that really trips people up is twisting and bending while they're showering. So you may notice here, this shampoo is not in a good spot. If I were to reach for it, I'd have to twist. Instead, you want to make sure that you keep items that you need right in front of you and that you can see it. So right here, right next to me. So much easier. Another option is introducing a long-handled sponge. So this is a piece of adaptive equipment that will help with reaching hard to reach areas instead of going like this, which would be breaking back precautions. You can also reach behind like that.
Another thing to keep in mind while you're at the sink is bringing everything to you and not bending. For example, when you go to brush your teeth, you bend down to get water or to spit. Instead, you can have a cup in place to gather water or to spit from to prevent you from bending.
Next, we're going to talk about getting dressed. So to start, I'm going to talk about putting on a pair of pants. So, when you put on a pair of pants, sometimes we're bending and we're lifting like that. We can't do that anymore with our back precautions. So first I'm going to talk about the first way you can do it is that you can put your legs in a figure 4 position like this, and then take your pants and go like that, and then finish switching your legs like that. And that would be if you have a lot of flexibility available to you. But if that's not available to you, we can also introduce a reacher. So like this, we have our legs all bunched up, slide the reacher in, and then bring it down to the floor. And then you just kind of slide your feet in like that. Might take some trial and error and wiggling around, but you just kind of feel out what feels best. Like that. And then you want to make sure you can bring it up, and once it's up to your knee, about knee height, you can pull it up like that.
The last part of lower body dressing to consider is putting on socks. So obviously, as Claire mentioned before, you can always try the figure 4 position, bringing everything to you. So bringing your legs to you and going like this and not bending. But if you can't quite get your leg up to your knee, we can always do a sock aid. And so you're going to want to put the sock all the way on it. And I always like to go all the way to the end so you can't see it anymore. And then sometimes I like to tuck the sock in here so it stays better in place. And then what you're going to do is drag it down. And you're going to go ahead and put your foot through and just start to pull. And there you go. And then something to keep in mind for upper body dressing is having big baggy clothes and even something that you can button up or zip, like this sweatshirt here. And that will just help with it, because anytime you're reaching above the shoulders, you're kind of starting to affect the spine more. So anything that you can just wrap around would be good.